Okay, so here we go. We're going to talk about colostrum and why does your baby need it? Everything you need to know about your first milk, what it looks like, why tiny amounts are exactly right, and how do you know if your baby's getting enough. I'm Karen. I'm a lactation coordinator for 17 years, so I just wanted to give you some information about what colostrum is. I also have a free guide if you want a free guide about breastfeeding and how quickly things are and all of the information about breastfeeding. Send me a message and I will get that right over to you. So, what is colostrum? It's your first milk and it looks nothing like the white milk you probably imagined. It is thick and sticky. It is golden and yellow in color. Sometimes it's called liquid gold, and it is exactly that. It comes in drops. Sometimes you just need a half of a teaspoon, and that's a complete feed, okay, on day one. It's not white. Mature milk is white, and that comes in about 3 to 5 days. When does your body start making it? Your body begins producing colostrum during pregnancy, sometimes as early as 16 weeks. It is really ready and it is waiting for the moment the baby arrives. It transitions to the mature milk again around 3 to 5 days. Colostrum is not a sign something is wrong. It is your first milk and it is perfect. Why are the tiny amounts correct? The reason colostrum comes in drops is because your newborn tummy is very, very small. So if you see my tip of my finger, day 1, it's a size of a marble. Day 3, it's a ping ball size. Day 10, it's size of an egg, right? So baby only needs just a tiny bit. They're going to feed very frequently, and that is very normal for your baby. A tiny tummy only needs a tiny amount. Drops are enough. Colostrum is concentrated and it's easily digest. So your baby will feed very often. It is packed with protein, antibodies, and it is immune protected. Think of it as medicine more than a meal. Your body has perfectly matched the amount to what your baby can hold. So if you think about it, if your baby's belly is as big as a marble, and then you have like a 2-ounce something, breast milk or formula or whatever, you're stretching that belly out, right? Has to hold it. Well, if it's so full, babies puke. Has nowhere else to go, right? Baby only needs a very tiny amount. These drops are not failure. That is your body being extraordinary. Extraordinary. So your body is perfect for your baby. And way back in the day when we didn't have formula, how'd we feed our babies? Breast. Right? And our bodies know what babies need. And our breast milk changes with our baby. So when your mature milk comes in about 3 to 5 days, it transitions from colostrum to mature milk and what to expect. Your breast will suddenly feel full, heavy, and tender, hard. Sometimes it's called engorgement. It is normal and is expected for this to happen. Some moms describe it as your breast feeling like little rocks overnight. And this is normal. Keep feeding your baby very frequently, and it usually settles in 24 to 48 hours. What to do? Keep feeding baby frequently is the most important thing. It tells your body I need to make more, and it's going to set up your whole journey to be very well going. Okay? Feed from both sides at each feed, especially in this time, because it can be painful at times. A warm compress before feedings and cold after can help. Engorgement means your milk is moving. and arriving. Keep feeding through it. So, how do you know if your baby's getting enough colostrum? Right? So, you can't see how much your baby's getting, but these are signs you can watch for. Babies need to eat 8 to 12 times in a 24-hour period. So, I want you to watch your baby, feed your baby. If your baby's fussy and you just fed your baby, feed your baby again. Could be cluster feeding, comfort feeding, all of the things. Put that baby to rest. Wear your baby. Your baby's used to you, your heartbeat, and smell of you. Get one of those things that ties them up to you and wear your baby. The first month is going to be the hardest. It's going to be the hardest, but you can do it. You're made exactly for your baby. Now, you're going to hear swallowing during feeds and a soft rhythmic gulp. The next thing you need to watch is how many diapers you have. Day 1, 1 of each. 1 pees, 1 poops. Day 2, 2 of 2. 3, 3 and 3. By 4 to 6 days old, they need 6 plus diapers, wet diapers. That is your watching tool. That's what you're going to watch. Babies will always lose weight in the hospital. Why will they lose weight? It's because they never had to regulate their temperature. They never had to eat before. They never had to regulate their heart rate. All of the things that babies never had to do before, right? They have to do once they land on your chest for skin to skin right after birth. They're going to lose weight in the hospital. So by 14 days, 2 weeks, your baby's going to be back to birth weight. If not, you need to call me. You need to call your doc. You need to call another lactation consultant. You need to know why your baby's not gaining weight. Okay? So you got to really watch those wets. 6 or plus by day 4 and on. Babies will start gaining by 2 weeks and up. Not losing. Okay? Babies seem settled after most feeds, not all feeds, but mostly. Their hands are relaxed, not like this. They're relaxed. They release the breast naturally. And babies are alert and responsive when awake. If you are hitting all 5 of these signs, the baby's getting enough colostrum. You do not need to see it to see if it's working. Those are your signs that babies are getting enough from you. When do you need to ask for help? Okay, this is important. You need to act on these signs right now and do not wait and see. The second you need to do it. Milk's not coming in by day 6. Fewer than wet diapers by day 4. Baby not back to birth weight by day 14. Baby who is very hard to wake up for feeds. Now babies will sleep. Babies will be sleepy. But if they're lethargic and not waking up all day and not eating all day, then there's something that's wrong. Call your doc. Call the baby's doc. Get to the ER, whatever you need to do. Okay? Baby's not transferring milk. Something else is going on. And for you, the most important, you feel like you cannot keep going. That is enough reason to go to the ER right now. Okay? Postpartum depression is a real thing. It can sneak up on you, and it may not happen in the first few days. It can happen weeks later. It can happen a month later. It can happen later in postpartum period. Okay? So, any of that, help is needed immediately. Your body made colostrum for this baby. It started making it months before baby is born. It knows exactly what it's doing, even when you feel like it don't. Give it a chance and do what is made, why it's made for a baby. Just do it. The first month is going to be the hardest. Hang in there. You've got this. So, again, my name's Karen. I have one-on-one sessions.